The official opposition Shadow Minister Nick Timothy.
Thank you, Dr. Huck, and I hope my voice manages to survive this speech. I think it's going around. I'm pleased to respond to this important debate on behalf of the opposition. I welcome the Minister to his new role. I know how knowledgeable and committed he is to the welfare of the children we're discussing today. And I congratulate the member for Dulwich and West Norwood on an important report by the Select Committee. She gave an excellent speech. And the members for Falkirk and Southampton Itchen spoke with experience of their roles in local authorities. And I know the personal experiences of the honourable members for Southampton Itchen and Cannock Chase make them especially important voices on these matters. And I want to send my thanks to both of them. The report sets out a sobering context. The need for children's social care has risen significantly over the past decade, with the number of looked-after children reaching 83,630 in 2024. That's an increase of over 20% compared to 10 years earlier. This increase has caused pressures on the provision of care for the children involved, and growing numbers of children are now placed far from where they live. We've heard a little bit about this in the debate, but last year 45% of looked-after children were placed outside their local authority area, and 22% were placed more than 20 miles away from home. The report found that there are serious shortages of foster carers, and an additional 6,500 foster parents are needed to fill the gaps. And I was pleased by the emphasis of the report on the importance of kinship care. I will say one thing which is a bugbear of mine, and not a proper criticism of the committee, but it does refer to kinship carers as an essential part of the care system. And I always find the language of systems quite dehumanising, when obviously kinship carers are vital, loving family members, and a responsible member of the family is always a better option than the inhumanity of a bureaucratic system. But as the report says, it's vital that kinship carers have the support they need and deserve. And if we can get children's social care right, the rewards could not be greater. Difficult starts giving way to new beginnings, great potential given the promise of a fair chance. And as the honourable member said, a reduction in some of the social problems that we contend with in other parts of government. But the report makes clear the consequences when we don't get this right. Children in care often experience trauma, abuse and neglect, and there are more than 4 times likely to suffer from emotional or mental health problems than other children of their age. The committee reported on the poor outcomes for too many of the care leavers, and the Honourable Lady mentioned this in her speech. 39% of care leavers between the ages of 19 and 21 are not in education, employment or training. 1/3 of care leavers become homeless within 2 years of leaving care. Almost a quarter of the prison population has spent some time in care. There are many fantastic organisations like Cangle Foyer in Haverhill in my constituency that do so much for vulnerable young people who find themselves with no place to live and little hope of getting the skills they need or a job they like without professional help to get themselves established. But demand for help of this kind would obviously be less necessary, less urgent, if we were successful in improving the social care system for children. And I know, after a recent Ofsted report into children's services in Suffolk, how much work there is still to be done. And Dr Huck, the Conservative Party agrees with the committee's recommendations for a national sufficiency strategy for children's social care and a reduction in the number of out-of-area placements, the development of a national care offer to harmonise support for care leavers, a new national fostering strategy and a register of foster carers, better financial support for kinship carers in line with support for foster carers, and permanent funding for the Adoption and Special Guardianship Support Fund. We broadly welcomed the measures relating to children's social care in the Children Wellbeing and Schools Bill and the policy paper called Keeping Children Safe and Helping Their Families Thrive. Much of this is a really welcome continuation of some of the policies we pursued in office, including powers to regulate the children's social care provider market and cap profits if necessary. and regulate the use of agency workers in children's social care. Indeed, we as a party have argued that there are some ways in which the government might be able to go further. For example, we have proposed amendments to the Children, Wellbeing and Schools Bill to require the Education Secretary to report annually on the work and impact of multi-agency child protection teams, which would have included their effectiveness in improving information sharing, risk identification and service coordination. There are also important questions about the relationship between social care and special educational needs. As again, I know from our experiences in Suffolk, demand for SEND places outstrip supply. Parents are waiting and waiting for EHCPs, and the system is buckling under the pressure. So I look forward to hearing what the government intends to do in relationship to SEND very soon. Vulnerable children are often not getting the care they need, falling out of the education system, sometimes altogether or travelling great distances, often more than 75 minutes at great expense, and sometimes leaving them more exposed to harm to get to the schools that we do have that they need. I know the plan for the white paper has been delayed into next year, but when the Minister speaks, if he could tell us a little bit more about the government's broad intentions and how he sees the interaction between special educational needs and the social care system, I would be grateful. And of course, we also have to raise some questions where the government has to date been reluctant to give answers. The Casey report into the rape gangs did not focus specifically on the systemic failings with social care, but it did show how children's services departments repeatedly failed to protect and support victims, vulnerable children who were in the care of the state. In Rochdale, for example, Baroness Casey said health services repeatedly shared their significant concerns with the police and children's social care about the organised sexual exploitation of children in the area, but nothing happened. And Anwar Mir, who was a social worker in Bradford, notoriously attended the so-called wedding of an underage girl in his care to her abuser. I find that absolutely extraordinary, and I'm surprised there was not a prosecution in that case. So will the Minister tell us what the government will do to earn the trust of the victims involved with the inquiry? And finally, when will we get that national inquiry into the rape gangs underway? Dr. Huck, every child deserves the best possible start in life. This is why this report is a welcome contribution from the Select Committee. This debate has been so important, and members across the House, regardless of party politics, have such an important duty to be constructive, to work together, and to do everything we can for every young person in our country. It is a duty, and we cannot let them down.